everyone. So my next topic of the video which I'm going to discuss with you is on peak drug concept. And now I'm going to discuss with you in this video about peak drug, what are peak drugs and peak drug concept. And before I start my video, I want to request you, if this video is useful to you and if it is helpful to you, kindly subscribe to my YouTube channel, that is Dr. Nitika Pharmacology Discussion. So now I'm discussing with you peak drug concept. Now, what is the background behind the use of peak drug concept is a doctor may see 40 patients per day or more requiring treatment with a drug. Now, patient load is so much per day. The doctor may see maybe 40 or more, and they require the treatment with a drug. How to choose the right drug for each patient is a relatively short time. Now we have to we have to choose the drug in a relatively short time to treat the drug, because he is seeing 40 to 50 patients every day. So they make a priority choice drug or the personal drug or the preferred drug which they have to give in any common diseases. So the right drug for each patient is in a relatively short time they can decide. By using P drugs, we can use P drugs, and in a relatively short time, they can decide which drug to prescribe, and then they can treat the disease of the patients of the more patient load of 40 to 50 per day. The P drugs are the drugs that you have chosen to prescribe regularly. These are the drugs the doctors use to prescribe regularly and which you have become familiar. And the patient has become familiar, the doctor has become familiar with this drug because repeatedly he is prescribing the same drug according to some criteria, and that the patient is regularly prescribing, so its safety, efficacy can be known easily. These are the priority choice for given indications, like in hypertension, the priority choices diuretics or ACE inhibitors, enalapril or hydrochlorothiazide. In the angina, glyceryl nitrate sublingual tablet is the preferred choice of these drugs. In peptic ulcer, we give the pantoprazole as the proton pump inhibitor is the most efficacious drug which we can give. In the same way, these are the priority choice drug for given indications. The P drug concept is more than just a name of a pharmacological substance, but it is more than the name of a pharmacological substance which we prescribe to the patients. Doctor prescribes to the patients. It includes dosage form. That includes it should be suitable. The dosage form should be suitable. Mostly tablets and capsules are easily taken by the adults as well as children, and injections, they are painful. So we avoid injections. We prefer the dosage form of tablet, capsule, syrup, solutions, inhalers. Dosage schedule. Means what is the dosage schedule? How many times the treatment has to be given? Means it has to be given OD, BD, TDS, TOID or SOS. Dosage schedule should be specified in the P drug. Duration of treatment, cost per total duration of the treatment. It should be specified for how many days it has to be given, for how many minutes it has to be given. That should be specified. Like hypertension and diabetes mellitus treatment, they're given for a minimum period of 15 days. They are given, and then the patient is asked for this follow-up. The P drugs will differ. Now, P drugs, they differ from country to country and between doctors also. Because they differ in the country to country. In some countries, some drugs are available. In other countries, other drugs are available. And between doctors to doctors, they are varying about availability. Means which drug is available and the cost of drugs. The least cost drug is preferred as the P drug because it is more economical. So it should be safer also. It should be varying availability. It should be available to the patient, to the general public as easily as possible. different national formularies. There are various national formularies of the countries and essential drug list. These vary according to the essential drug lists as well as the national formularies, the P drugs. Medical culture. What is the medical culture of that particular area? It may be differing from P drug from country to country as well as between doctors. Individual interpretation of information is what information they have got from the medical representatives about any drug, about the safety, efficacy, tolerability, cost of any drug. This how they interpret the information, the doctors, that varies accordingly. The P drug choice varies accordingly. P-drugs enable me to avoid repeated searches for a good drug in daily practice. When the doctors, they already have a preferred choice of drug, priority choice of drug, personal drug for any particular disease. So the repeated searches for a good drug in daily practice, it's avoided. As you use your P drugs regularly, you will get to know their benefits and side effects thoroughly. As they will use prescribe to the patients, they will get to know the benefits by whether they meet the primary and secondary efficacy endpoints. The side effects of the drugs will be known to the doctor very easily because these drugs will be prescribed regularly to the patients and the patients will come give you the feedback about the drug. P drugs are the drugs of first choice for common conditions. These are the first choice, priority choice, personal choice, preferred drug in common conditions. Not a drug for the individual patient. It is not the personalized drug. It is not according to genetic makeup of the individual. It is according to the general public and not in the common conditions. What all P drugs we have to give. It is according to that. Now, institutional, national, and international, including WHO standard treatment guidelines, have been developed to deal with the most common conditions. Now, there's certain standard treatment guidelines available for various common conditions. According to those guidelines, we choose the P drug, preferred drug, uh, for the common disease conditions. They're based on good scientific evidence. Means we will do the studies in the of the drugs of the new drugs will be done, and we will study the pharmacokinetic, pharmacodynamic parameters of the drug, the cost, safety, efficacy, tolerability of the drug has been studied, and then uh, experts they study the drug. Good scientific evidence is there, and then we choose the P drug. They are a valuable tool for rational prescribing and to be considered while choosing P drug. They are the valuable tool. As we do the studies, so we will the P drug will be selected accordingly for the rational prescribing and for choosing the P drug. List of essential drugs contain many more drugs than you are likely to use. The list of essential drugs, they contain many more drugs than you're likely to use. It contains a lot of more drugs. These are not the P drugs. Most doctors use 40 to 60 drugs per day. It is therefore useful to make own selection from these lists. There's a lot of number of essential drug lists is prepared and they choose from these essential drug lists, and to make the selection in a rational way, they choose the P drug from the essential drug list and then they prescribe to the doctor. So that rational prescribing is done. In fact, in doing so, you are preparing your own essential drug list. And when you select the drug from the essential drug list and from the standard treatment guidelines and various national formularies, you are preparing your own essential drug list. Now, choice of P drug. How we choose the P drug? A P drug is selected depending upon the following criteria. It is safety. Step criteria is this. S for safety. We look for the various adverse effects of the drug, tolerability, suitability for the patient. If the injections are like suitable to the patients, and oral tablets and capsules, they are, and syrup solutions, inhalers are more suitable. And some drugs, they are avoided in the disease condition patients like renal and hepatic disease, or heart disease like CHF, heart block, like beta blockers. They are avoided in patients who are suffering from CHF, bronchial asthma, diabetes, Raynaud's disease. This is according to suitability for the patient. We select the P drug. Efficacy drug profile is according to pharmacokinetic and pharmacodynamic parameters. We study the efficacy of the drug. Price, always look at the total cost of treatment rather than cost per unit. Cost per unit, cost per day is not seen. We look for the total cost of treatment. We look for the total cost of treatment rather than the cost per unit. Remember that a P drug is a drug that is ready for action. Just the P drug is a drug that is ready for action. Process of choosing a P drug. Now, how we choose the P drug? First of all, we define the diagnosis. The patient comes with various symptoms and signs, and the doctor therapeutically makes the diagnosis by doing various lab tests and investigations, and by knowing the symptoms and signs of the patient. The doctor makes a diagnosis. Then they set the therapeutic objective, like in blood pressure, the diastolic and systolic blood pressure should be uh, below 80 by 120 millimeter of mercury. Fasting blood glucose levels in diabetes should be less than 100 or 126, and random blood glucose levels should be less than 200 milligram per deciliter. So these are the therapeutic objectives. This is how we have to set the primary and secondary efficacy endpoints, and these have to be met by the various drugs. Now then we make the groups of the drugs by which can treat that particular disease, groups of the various drugs. And then from that, according to step criteria, we choose the effective group. Step means S for safety, T for tolerability, E for efficacy, P for price. According to that, we choose the effective group. And then we choose the P drug according to dosage form, according to dosage schedule, according to duration of treatment of the drug. And we choose accordingly, again according to step criteria, we make the choice of the P drug, that is safety, tolerability, efficacy, and price. Now make a diagnosis, definite diagnosis. How? We have to understand the pathophysiology of the disease. Treating symptoms without really treating the underlying disease is called symptomatic treatment. What is symptomatic treatment? It is we treat the symptoms of the disease and without treating the underlying pathophysiology of the disease. Set therapeutic objectives. Consider the long-term desired benefit to the patient. This is how we have to reduce the systolic or blood pressure, diastolic blood pressure, and hypertension. Fasting and postprandial blood glucose levels should be decreased. HbA1c levels should be decreased in diabetes. In the same way, various long-term desired benefit to the patient has to be considered. For example, in hypertension, there is systolic and diastolic blood pressure reduction, diabetes, fasting, and postprandial plasma glucose levels should be reduced. In tonsillitis, the infection should be reduced. Therapeutic intervention by giving the antibiotics and steroids, we can reduce the infection in the inflammation and infection in the patient. Hypertension, how we have to set the therapeutic objective is we have to reduce the levels of the blood pressure, systolic and diastolic blood pressure. How? So that we can prevent the end organ damage by regular treatment for lowering blood pressure to normotensive levels. End organ damage has to be prevented. Delaying the complications of diabetes by normalizing blood sugar and HbA1c levels to acceptable normal limits. Means we are preventing diabetic retinopathy, nephropathy, neuropathy, peripheral neuropathy in diabetes, and other complications by maintaining the sugar level and HbA1c levels to acceptable normal limits. Acute tonsillitis, we can provide the symptomatically for the self-limiting disease by giving a short course of antibiotics and supportive therapy. Which we can give the for the fever, we can give paracetamol. For the inflammation, we can give steroids, antibiotics to treat the infection, and we can give the symptomatic relief. And as acute tonsillitis is the self-limiting disease. Make inventory of effective group of drugs based on efficacy, safety, suitability, tolerability, and cost of treatment. That is based on step criteria. We will make the inventory of the effective group of drugs. Inventory of the effective group of drugs. How we write the groups underneath, like in the angina, we write the beta blockers, we write the nitrates, we write the calcium channel blockers, and accordingly the efficacy, safety, suitability, and cost is seen. Total score is added, and then we select the effective group. In this step, we link the therapeutic objective to various drugs. Efficacy is the first criteria for selection. Initially, look at groups of drugs rather than individual drugs. Because we have to look at the group of drugs. All drugs with the same dynamics, that is pharmacodynamics, and a similar molecular structure belong to one group. Because all the drugs like nitrates, nitrates, dinitrate, trinitrate, isosorbide mononitrate, isosorbide dinitrate, pentanetol, isosorbide nitrate. So that the drugs, they have the similar molecular structure belong to one group, means their effects, their efficacy, their side effects, their contraindications, their interactions are similar. Look at formularies or guidelines for certain common disease groups. Then we can look for the, first of all, we can know about the efficacy of the drugs accordingly to the molecular structure. Then we can look for the national formularies and standard treatment guidelines for certain common diseases. In most cases, we will find only 2 to 4 groups of effective drugs. And then we can find the from the essential medical list or formularies or standard treatment guidelines, we can select 2 to 4 drugs of effective groups. Choose an effective group according to efficacy, safety, suitability, price, and cost. Efficacy: drug has to reach a minimum plasma concentration with an easy dosage schedule. They have to be reached the minimum plasma concentration in the body with an easy dosage schedule. Means like we can give the fast acting drugs, like we can give the tablets, we can give the capsules, or we can give syrups, solutions. We can give topical application also, or sublingual tablets in case of the angina. Kinetics should be compared on the grounds of absorption, distribution, metabolism, and excretion. Since we have to look for the pharmacokinetics, we have to look about the pharmacodynamics. Criteria for selection of essential drugs. Priority should be given to drugs of proven efficacy and safety. Those whose drugs has proven efficacy and safety, they are mostly given. Unnecessary duplication of drugs and dosage forms should be avoided. Because we are not going to duplicate the drugs of the, like we are giving one drug of from the same group, or we are giving 2 drugs from the 2 different groups. This duplication of drugs should be avoided, and dosage forms should be avoided. Newly released products should only be included if they have distinct advantages over products currently in use. Now, newly released products, they should be included only if their advantages over current, if they are having more benefits, or they're less, they're more safer, or the cost of treatment is less. So they have a distinct advantages over the currently used drugs. Then only we can include them in the pre-drug list if they are more efficacious, more safer, more less costly. Then we can use this, more suitable. Then we can use in comparison to currently used treatment. Each drug must meet adequate standards of quality, bioavailability, and stability. Because their shelf life should be more, and they should be more bioavailable. The quality, the efficacy should be good. The international non-proprietary name, that is the generic name of the drug, should be used. Means when we prescribe the P drug, we should give the drug in its generic name. The cost of treatment and especially the cost-benefit ratio of the drug or a dosage form is a major selection criteria. Means we have to look for the total cost of treatment during the duration of the treatment. By considering the total duration, we have to calculate the cost of treatment, and especially the cost benefit ratio of a drug has to be specified. It has to be looked for. If the benefit is more, cost is more, cost is less, that has to be more efficacious drug is there. And dosage form is the major selection criteria. Like easy dosage forms, less painful dosage form is the peak drug. When two or more drugs appear to be similar, preference should be given to the drugs which are more thoroughly investigated. Means the drugs whose study on which the studies have been done, various evidence-based studies have been done, that drugs should be preferred. Drugs with more favorable means absorption, distribution, metabolism, excretion, availability should be more. So with more favorable pharmacokinetic properties, it is selected. Drugs with reliable local manufacturing facilities means they are manufactured locally, easy availability of the drug is there, that should be selected. Most essential drugs should be formulated as single compounds. With the essential drugs, they should be formulated as single compounds. Like fixed ratio combination products are only acceptable when the dosage of each ingredient meets the requirements of a defined population group and when the combination has the proven advantage over the single compounds administered separately in therapeutic effect, safety, compliance, and cost. Because mostly the drugs are given singly, but we can use the fixed dose combination also when they have a proven advantage. Like they are more efficacious, they are more safer, the fixed dose combination, they are more compliant, and the cost is less. Only then we can use the fixed dose combination of the drugs. Safety. This encompasses possible side effects and toxic effects. Frequent side effects and safety margins should be listed. Almost all side effects are directly linked to the working mechanism of the drug, with the exception of allergic reactions. These are basically because of the pharmacological action, the mechanism of action of the drug, adverse reactions, and the idiosyncratic are the allergic reactions. Suitability final check will only be made with the individual patient. Individually, whether the patient is suitable to take that medication. Some general aspects of suitability can be considered while selecting your P drugs. Contraindications related to patient conditions such as illnesses, pregnancy, lactation, drug interactions may lead to alterations in P drug. It is like there can be hepatic disease, renal disease, cardiovascular diseases, diabetes. If the patient is suffering from these illnesses, then we have to make a proper diagnosis, which are safer drugs are there. And if the patient is pregnant or lactating or various drug interactions are there between the two drugs, so we alter accordingly the P drug. The safer drugs are given in pregnancy and lactation. No, teratogenic drugs are not given. How to select the P drug? Define the diagnosis, pathophysiology, specify the therapeutic objective, make inventory of effective groups, choose a group according to criteria. That is step criteria. We make the inventory of the effective groups, and accordingly we choose a group according to step criteria, that is efficacy, safety, suitability, and cost. Like 2-3 groups are made. Accordingly, we will choose from these 4 parameters, and then we choose a P drug again. Drug 1, drug 2, drug 3 are there, and then according to step criteria, we choose the drug according to the active substance and dosage form. Standard dose schedule and standard duration, we may choose the P drug accordingly. This active substance, dosage form, dosage schedule, and duration of treatment. Now, case presentation 1. Patient is 60-year-old man came with complaint of suffocating chest pain radiating in medial aspect of the left arm, which began during the evening walk. So this is the angina pectoris. We define the diagnosis: acute attack of angina pectoris because of partial occlusion of coronary artery. Stop the attack as soon as possible. This is the specified therapeutic objective. Reduce myocardial oxygen need by decreasing preload. We can decrease the preload and we can reduce the myocardial oxygen need by decreasing the preload, contractility, heart rate, afterload. Make inventory of effective groups: nitrates, beta blockers, calcium channel blockers. Choose a group according to criteria like nitrates. These are more efficacious, more safer. Only tolerance can be there, or flushing or hypotension can develop. Suitable because these are given in the tablet form, so they are suitable. Cost is also fine. Beta blockers, these are efficacious, these are safer also, but they can cause heart block or they can cause they can precipitate congestive heart failure. They can cause the heart block. They can cause vasoconstriction leading to Raynaud's phenomena. They can cause they can worsen the bronchial asthma. So these are less safer. Suitability, because in the bronchial asthma patients, in diabetes patients, in Raynaud's disease, and congestive heart failure, in AV block, sinus bradycardia patients, we cannot give this drug. Cost is also more. CCBs, these are also efficacious and these are more safer. And again, these are not suitable for congestive heart failure patients. They cause heart block and they can cause hypotension also. And cost is also not favorable, means these are more costly. And basically, these are given in injection form, so these are less suitable. P-drug, glycerol trinitrate tablet, spray, isosorbate mononitrate tablet, isosorbate dinitrate tablet. Now this is glycerol trinitrate tablet. This is more efficacious. All these are more efficacious. Safety also margin is also positive, negative, same. Like they can cause flushing, they can cause hypotension. These are not so. They can cause tolerance. These are not so harmful. Uh, Adverse reactions. Suitable, these are all suitable. Also cost is less of glycerol trinitrate tablet, but others they are more costly. So accordingly, from the cost we can choose that glycerol trinitrate tablet is more efficacious. We choose it as the P2. Conclusion: active substance, dosage form. Active substance is the glycerol trinitrate. Dosage form is sublingual tablet 1 milligram. Dosage schedule is 1 tablet as needed. Second tablet if pain persists. We can give glycerol trinitrate 1 tablet as needed. Second tablet if pain persists. Duration, length of monitoring interval. Duration, like we can give length of how much we have to monitor the patient. Accordingly, we can give the drug like 3 to 5 minutes. We monitor the patient, and if the pain does not subside, then we can again give the tablet sublingually. Thank you. That's all for my discussion on P-drug. I hope you understood. And if you understood this video, kindly subscribe to my YouTube channel, that is Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed. Stay safe. Thank you. Happy learning.